Hello, welcome to the One Health podcast with me, Sapon Kumankuma. This is our first episode and it promises to be very educative and exciting. And today with me to discuss the role of veterinarians in safeguarding human health is Dr. Abbiw Richard. Doc, you are welcome.
Thank you very much.
So Doc is a fresh graduate, and Doc, how is the world treating you so far? How has it been, the practice?
The practice promises to be fun, except most of the time it's very stressful. You spend the time running around and trying to salvage situations and getting whatever you have to get in return. In general, it's okay. It's fun. It's fun.
And I think everything is worth it then.
Perhaps it's too early to say, but I think eventually I'll be able to confirm that everything is worth it.
You are doing a good job.
Thank you.
I must confess. And so to begin with, who is a veterinarian?
Basically, a veterinarian is the doctor of animals, the simplest way you can put it. That's without looking at the nitty-gritties. But to the layperson, veterinarian is the doctor of all animals, or the person who doctors animals, mammals, birds, reptiles. Their doctor will be a veterinarian.
So all animals. That's
not necessarily. Scientifically, if you're looking at the fact that human beings are considered by some as animals, then vets will be all animals but human beings in most situations. Yes.
So most of the time, as a vet student working around you, when people realize you're a vet student, the first comment they make is, then you'd be preparing to leave the country because you are, per their ideologies, you are not relevant in the country. So how relevant is veterinary medicine to Ghana?
Veterinary medicine is very relevant, whether the students or whether the people in Ghana, that's Ghanaians, find it important or not. In other words, it's not up to the people to decide our importance. Our duty to the animals and people in Ghana is not defined by the decisions and the thoughts of the individuals traversing the land. What I'm trying to say is that majority of the people in Ghana don't know about us in the space that we need them to. Therefore, they think of us as non-important or not important, let me put it that way. However, that doesn't truly define the importance of the profession. Therefore, even though most Ghanaians would not think of veterinary as important, the profession makes it so. Or Ghana actually need vets. We need vets at our borders. We need vets to take care of the pets. We need vets for the production animals. We need vets for certain even human diseases that may come because the vets will see it first in the animals and can tell the fellow physicians at the human side to work it out. So Ghana actually needs the vet, even if the people in it don't realize that's the situation. So it's not dependent on whether they like it or they don't. It doesn't work that way.
Okay. So as you were speaking, you mentioned human diseases.
Mm-hmm.
Yeah. So how is veterinary medicine similar to human medicine?
They are the two sides of a coin, if I can put it that way. Basically, veterinary medicine is learning human medicine, except the main focus here is not the human being, because most of the time we spend the time in school, as you can approve, we spend the time in school comparing the animals to the humans so that understanding becomes easier. So it's relatively very similar. Human medicine and veterinary medicine are perhaps equal, except the focus is different. Whilst the human doctor or the physician will focus entirely on the human body with very little or no emphasis on the animal, the rest of the animal, the vet has to mop up the knowledge and learn and treat the rest of the animals. So they are about the same thing, just different hosts, or different patients.
So the difference then, the only difference, significant difference is the patient.
Yes, and the relevance we attach to the patient. As I was telling you, for example, in Ghana, they may not consider veterinary, many people may not consider veterinary as important, which is okay because that's their belief. We can't shove things down their throat. But then the relevance generally, globally, everywhere attached to human life supersedes those attached to almost all animal life, with the exception of those really endangered, those that are about to be extinct, say the white rhino. Then if somebody decided to go and attack a white rhino, perhaps they may choose the life of the white rhino over the human being.
Exactly.
But in all situations, or most, say 99.9, the relevance attached to life for human supersedes that of animals. And therefore, the relevance or the importance given to the physician, most situations supersedes that of vet. But in real life, in truth, if I may put it that way, it doesn't have to work that way because it's an ecosystem and everything is intertwined. You can respect humans all you want, but if the animals are coming down and the disease can affect human beings, eventually it will come back to worry you.
So, with all this knowledge, with the similarities and all, can a vet ever treat a human being?
It's yes and no. It's a matter of policies, laws, confidence, and knowledge. Is that yes, a vet can treat human beings if you can diagnose the disease because you have been taught how to diagnose diseases. So in the absence of a doctor, you may be able to diagnose certain diseases, not all, because you don't know majority of the things that worry human beings. You've learned some by virtue of veterinary, being a veterinary student in public health, you've learned certain human diseases. And I believe medics too have learned certain animal disease, either in public health or in the zoonosis class. That's disease affecting both sides, whether human or animal, crossing boundaries. But that does not give you the legal authority to do so. So the fact that I can identify malaria in a human being, and then I know the drugs for malaria in a human being, doesn't give me the authority legally to tell people to go and take that medicine in human being, to go and take that medicine. However, there are certain basic first aid advice that I could give somebody and refer to the clinic or hospital. For example, if I met somebody in an accident, there's an accident, the person is bleeding, I wouldn't say I will not do anything because I'm a vet and the person is not a good. That wouldn't apply. You get it? I would have to, I know how to stop bleeding. And in the absence of a doctor in that situation, I believe I'll be the next best qualified, the next person who can do the job better. So I can stop that bleeding, refer the person, or call whilst ambulance is coming, stop. And if it's beyond my scope of knowledge, there is no point doing it just because you also carry about a DR. The fact that you're a doctor doesn't mean you know everything. So if your knowledge on the situation is little, and then you cannot actually do anything about it, there is no point trying. It's just like that way. In the same way, you do not expect the medic to treat his pet just because he's learned medicine or she's learned medicine. If you did that, you may end up killing the animal or even be successful. And either of that wouldn't matter because there are rules that clearly differentiate the job. So yes, both of us can do each other's job to some extent, but then it doesn't mean we should. In the absence of one and with enough knowledge by one, you can fill in. You don't have to do it just because you're a doctor and you know and you go about telling people you're a doctor and stuff like that. You get my point.
So if then the impact of vets on humans is not that direct.
Not necessarily. It's not really direct. So there are some instances that it's actually direct, but most instances there should be a flaw at one side so that the other feels the impact. So there are diseases that started from human beings and then we later found them in animals. And then those that started from animals and then we find in human beings. Okay. Even, for example, the new coronavirus thing that is all over, the COVID-19, the disease was seen first, from what I've read, first in human beings. And it was when they traced it that they realized that it had an animal source. Yes. So it means in this case, if the veterinarians who worked on those animals had seen it first and they had investigated the potential of it affecting human beings, perhaps it could have been avoided. Or when the human beings saw it first, they kind of told the vet, and then the vet also did their part. But all that wouldn't matter anyway, because now it's in the situation and it might even be a bad example. But the point is the two work together. So the impact might not be directly felt, but eventually when one keeps on not doing the job, the other feels it. Say in mining communities, that's a classic example. In mining, our galamsey zones where they are using mercury. The levels of mercury that will cause disease in human beings and that of animals like dogs would differ. However, even it might be higher in human beings, I don't know the exact value, than dogs, which I know is pretty low. Therefore, if vets realize that the dogs or pets in that community are coming down with particular symptoms, signs, which indicates that it's mercury poisoning, they could tell their colleagues, who would then get their attention drawn to it, so that if other human beings are exhibiting certain signs, they would quickly think mercury poisoning, because symptoms come, the symptoms of disease are alike, basically. Most of them, they are alike. So then their attention will be drawn, and vice versa. So the effect is indirect, but if one doesn't work, you can actually tell it in the others, the patient, to some extent.
Your galamsey example reminds me of a real life situation that happened in Nigeria. So communities in Zamfara State where they witnessed that the duck population was reducing. The ducks were dying, but no one paid attention to that until the children began to die after showing symptoms of vomiting, abdominal pains, and seizures. So upon investigation, they realized that it was lead poisoning due to mining activities.
If the vets were giving attention to that, or even if there was any vet there who even saw it first and decided to tell the medics, they wouldn't have spent time beating about the bush with the kids' life. They would have just gone straight to the point, tested for lead. Because the symptoms, stomach ache could be a lot of things. We call it acute abdomen. There could be a lot of things that cause from obstruction through to poisoning. And the doctor to see through all this, that's life being lost. You see.
Okay. So aside their role in controlling certain diseases, in what other ways do vets protect human health?
Well, we also protect human health other than the direct, by protecting our livestock so that they don't get. We also protect from the abattoirs through public education and all that. So, for example, during meat inspection, if vets are allowed, they have the mandate to do anything, then they would inspect, and we can tell certain diseases even without a lot of clinical signs. Sometimes asymptomatic diseases that are apparently asymptomatic, you can tell from certain basic laboratory tests that you can conduct. And therefore, when the vet is involved and he realizes they can stop the slaughter of such animals, and that will not get into our market. Again, on the most, one of the distress situations we have in antibiotic resistance. Vets can also contribute in the sense that we can regulate the amount of antibiotics farmers use, and the withdrawal periods would be respected because the vet would enforce that the best way he or she can. And that means the meat or food, animal products coming into the system would contain the minimum amount of antibiotic we need in this product so that we don't develop resistance in human beings. These are some of the ways that vets can help protect the human. The least of it is even like the disease like rabies. Vets could tell rabies in dogs. Severally, people have come to me saying their dogs are mad. They are mad. They are going about biting other dogs. They are mad. And when after biting, those dogs should become mad. And these are people who killed the apparently mad dog and eat. But from their story, you realize that these are rabid dogs. Of course, eating the rabid dog might not necessarily give you rabies. But if you're cooking it and you get scratched by anywhere we have saliva, maybe the teeth, then you are putting your life in danger. So all these things, then you educate the person. Okay, the mad dog could actually be rabid. When you see it, when you kill, avoid it. Just bury it. When you see it, or even if you want to be careful. If you see a mad dog, call your vet. Let's see what's wrong. then you save a life, because the mad dog could bite a crazy kid.
Yeah.
And that will send crying and spewing saliva on the mouth. And then the thing goes on. So vets eventually contribute that way. Another field we contribute in is pharmaceuticals.
Yeah.
We have the laboratory animals. They need veterinary care. So if they are not alive, basically you don't use them, right? Stuff like that. So vets contribute a lot to the human side by protecting us through protecting the animals. So that we share a lot of things with these animals. And it will be not okay to be not cool for you to think that we are an isolated system. Human beings are so special that nothing affecting the rest can touch us. Like all the animals can die and then we'll be okay because we have all the technology. No. It doesn't work that way. We need the animals alive, in good health, in the way that they should be, so that they don't give us any of the diseases that we are getting from them, which is alarming. The report is not really consistent, but on the average, we are thinking between 60 or 50 to 80% or 90% of human disease being from animals. I'm saying no constant. Some say 70, some say 60. So let's make
some even make it as high as 85.
So even if it is 50%, that is still scary. It's not a cool thing. So we can leave it. And vets do their work by consulting, by preventing the disease, or even consulting the medics. We help protect the human population.
Wow, that's good. Then it's not surprising a vet once won the Nobel Prize for medicine.
I didn't know that. Who is that?
Peter Doherty. I think in the year 1999.
Oh, that's cool.
Yeah, for his work in immunology. So
that's one sector that is maddening. It's so difficult. Not difficult per se, but reading it is tedious. You have numbers and alphabets. It's tedious reading that.
It has been a nice time, Doc, and I think our listeners are educated and enlightened. But before we go, any final thing you want to say to our listeners, or anything you want to add to the discussion as we run it off?
If there is anything I have to tell listeners out there, is that you don't have to respect per se as we know it in our local setting. You don't have to kneel down or bow or say yes sir to the vet. You don't have to do any of that. You can still keep your opinions as an individual. You can dislike vet because of experience, and you have the right to feel that way. However, in feeling that way, learn to listen to the vet, because ignoring the vet could be detrimental. Sometimes it's asking too much, because you ask somebody not to kill the fattest cow because the cow is possibly having TB, so you should dig a hole and put there. It's having a malaria, like the TB spread all over, systemic in nature. Most organs affect, so you should just put the cow in the grave. That's hard truth you have to tell somebody, and they will not listen. It's difficult for you, so you may not like the vet. It's okay, but at least listen to us. And then you are at liberty to question our decisions, because it's your animal, it's your life. You question, and the vet would have to explain. So once that happens, eventually the respect comes by itself. Both parties respect. If you go about thinking you have to say yes, sir, hello, bow, these are what we know to be respect here. Exactly. And I'm telling you, you don't have to. You just have to listen to the advice we give and actually do it. Because if you don't, eventually it comes back to harm either you, the next animal, the next person, or even the vet, which will not be cool.
Yeah, all involved.
Yes. It's a whole system. It's an intricate system that one wire pulled brings down the whole block, the whole fabric in a very long time. Yes. Or even sometimes short time. So just learn to listen. It's difficult, but learn to, and that will help all of us. And also question. Don't just listen. And the whole veterinary system or medical system has evolved from where they thought doctors were gods to where doctors are just the average knowledgeable people who know a couple of things that one. So you should also question. You should read, ask questions, demand answers for it. Yes, but in all, learn to listen to advice. That would be good for everybody. And to students, I guess to the students, I say this and people get angry, but On record, veterinary is very easy. You just have to.
A lot of people disagree with you on that.
I know. Because I've been through it. I'm telling you, it's easy. You just have to understand you are going to be a vet, and there is way too much to learn. Therefore, be a vet student. You can't be a vet student and pretend to live the life other students, names withheld, will do. You can't do that. You have to always go back to your books every day. Yes, you have to have fun. Yes, you have to hit the gym, the movies, club, whatever makes you happy, you have to do it. But at the end of it all, remember you are a vet and you would keep on writing so many tests, some unnecessary. You'll be tormented. You have big books to read and you have to remember them. Oh, just to chip in, I remember in level 600, one of my last papers, the teacher decided to ask us a question, the lecturer, about amputation. When I read the first line, I was so excited because amputation is relatively easy to do. It's literally like getting blood vessels that are important and then you cut. But the lecturer didn't ask us to describe the procedure. He told us to name the vessels and that's the blood vessels and the nerves that traverse that part of the body. And that's like level 200. Nobody remembered. Not a single soul. We all just failed. We had to go and beg it. Like, you just have to always remember, go back and revise. Do not think you know. Once you can't remember, it means you've forgotten and you can't lie to yourself. Once you do that, veterinary becomes easy. And after school, you enjoy it. It's fun.
The enjoyment part was what I was waiting for.
Oh, you enjoy it, but the enjoyment is closely tied to being tired. So if you want more enjoyment, you have to work. If you enjoy the work, then it's easier. If you don't enjoy the work and you just want the money or something, it gets that's personal experience. You can ask other doctors. Maybe they have a different trick to it, but so far, I've realized if I want the cash, I gotta work. And it's not easy, but it'll be fine.
Yeah. Doc has been stressing on the academic part because this is for your years only.
What about that?
Was the overall best graduating student.
Is it true?
Yeah, for the year. Which year?
I don't know, you are saying it.
Yes. So thank you very much for coming.
Welcome.
It has been the One Health podcast, and our guest was Dr. Abbiw Richard, a houseman at the University of Ghana Small Animal Teaching Hospital. Thank you, listeners, for making time with us. Have a lovely week.